Have you ever walked out of a doctor's appointment and thought, wait, I forgot to ask about that thing that's been bothering me for weeks? Or maybe the doctor came in, asked a few quick questions, and before you knew it, 15 minutes had passed. They were heading for the door, and you were left holding a prescription you weren't sure you understood. You're not alone. Not even close. Doctors today are busy. The system is fast. And when you're sitting in that exam room, maybe a little nervous, maybe not feeling your best, it is so easy to walk away without getting what you actually came for. But here's what I want you to know. Your health is your most important asset, and your voice, the questions you ask, the concerns you raise, the information you share, that voice can change the quality of your care. Today, I'm going to give you a simple, practical system for making every single doctor's visit count. No medical degree required. Just a few tools, a little preparation, and the confidence to speak up. I want to speak to you directly today. Not to your children, not to your caregiver, to you. Whether you're managing one health condition or several, whether you've been seeing the same doctor for 20 years or you're navigating a new specialist, whether you feel confident in medical settings or they make you a little anxious, this is for you. Because the truth is, the most important person in your healthcare team is you. And today, we're going to make sure you feel ready to show up as exactly that. The single biggest thing that separates a frustrating doctor's visit from a productive one? Preparation. And I'm not talking about anything complicated. I call this the pregame. The 5 to 10 minutes you spend before your appointment that can completely change what happens in that room. Tool number 1, the yellow folder. Here's your first tool, and it's beautifully simple. A yellow folder. Why yellow? Because it's easy to find, easy to hand to someone, and it stands out in a medical setting. But the color doesn't actually matter. What matters is what's inside. In your folder, you'll keep 2 things. A current list of all your medications, with the dosages and what each one is for, and a list of all your doctors and specialists, with their phone numbers. This one folder could save your life in an emergency, and it makes every appointment go smoother. Action. This week, gather your medication bottles and write down the name, dosage, and reason for each one. Put it in a folder. Keep that folder somewhere you can grab it quickly, by the door, in your bag, on the counter. And if you have a family member or caregiver who helps you, this folder is something they'll thank you for too. Now, how many concerns do you typically walk into an appointment with? Maybe 5 things, maybe 10? Here's the hard truth. Your doctor, in a standard appointment, will realistically address 2 or 3 issues well. If you bring 10, you risk leaving with none of them truly resolved. So before every appointment, I want you to do one thing. Write down your big 3. The 3 things that matter most to you right now. The things you absolutely cannot leave without discussing. Put them in order of importance. Lead with number 1. That way, even if time runs short, you've addressed what matters most. Tip: keep a small notebook or use a notepad on your phone and jot down concerns as they come up between appointments. Then, when it's time to prepare, you already have your list ready. The STAR method for describing symptoms. When something is bothering you physically, one of the most helpful things you can do is describe it clearly. And the STAR method is one of the best ways I know to do that. S stands for specific. Where exactly is the discomfort? Not just my back. Is it upper, lower, left side? Does it radiate anywhere? T stands for timing. When does it happen? In the morning? After eating? Only when you climb stairs? A stands for associated. What else happens at the same time? Does the pain come with dizziness, nausea, shortness of breath? And R stands for rating. On a scale of 1 to 10, how much does this symptom interfere with your daily life? Not just the pain level, but your life. can you still do the things you love? STAR. Specific, timing, associated, rating. Practice. Think of one symptom you've been meaning to mention. Run it through STR right now in your head. You'll be amazed how much clearer your description becomes.
The buddy system. Whenever possible, especially for important appointments, bring someone with you. A family member, a trusted friend, a caregiver. Someone who can listen, take notes, and remember things you might not catch when you're focused on the conversation. You are there to have a conversation with your doctor. Let your buddy handle the note-taking so you can be fully present. And if you can't bring someone in person, many doctors now offer phone or video participation for family members. Ask if that's an option. Reminder, having a second set of ears is not a sign of weakness. It is one of the smartest things you can do for your health.
The repeat back technique. Before your doctor leaves the room, I want you to try something. Say these words. Just to make sure I have it right. The plan is, because of, is that correct? That's it. You're simply repeating back what you understood to make sure it matches what they intended. You'd be surprised how often this one simple sentence catches a misunderstanding or prompts your doctor to explain something more clearly. Doctors appreciate this. It tells them you're engaged, and it ensures you leave with a clear plan, not a foggy memory of a rushed conversation. Strategy number 3, medication safety, generic versus brand names. Here is something that trips up even the most organized people, and it can be genuinely dangerous. Many medications have 2 names, a brand name and a generic name. Lipitor and atorvastatin, for example, are the exact same medication. Warning, some people end up with 2 bottles, one brand, one generic, and accidentally take double the dose. This is more common than you'd think. Every time you pick up a new prescription, ask your pharmacist one simple question. Is this a generic for something I'm already taking? Your pharmacist is one of your most underused healthcare allies. They see your full medication list, they know drug interactions, and they have more time than your doctor does. Use them. One question to the pharmacist could prevent a serious mistake.
I want to talk about 2 situations that make a lot of people uncomfortable, but that everyone needs to know how to handle. When to push back. If a doctor tells you that's just old age in response to a new symptom, a symptom that is new, that wasn't there before, that is not an acceptable answer, and you have every right to say so. Try this. I understand aging plays a role, but this is new for me. I'd like to understand it better. Can we explore it further? If you're in a hospital and you feel rushed or dismissed, ask to speak with the patient advocate or the charge nurse. Every hospital has these roles, and they exist precisely to help you. You are never being difficult by asking for clarity. You are being your own best advocate. The discharge stoplight. If you or a loved one is ever discharged from an ER or a hospital, before you leave, ask 3 questions. I call this the discharge stoplight. Green. What does a good recovery look like? What should I expect in the next few days? Yellow. When should I call the doctor? What symptoms mean I should check in but don't need to rush back? Red. When do I come straight back to the ER? What are the warning signs I absolutely cannot ignore? Green, yellow, red. Write those answers down before you walk out the door. Print the discharge stoplight and keep it with your yellow folder. It's in the free checklist linked below.
I want to say something before we close, and I hope it lands the way I mean it. Everything we've talked about today, the preparation, the communication, the advocacy, it's so much easier when you don't have to do it alone. Having someone with you at appointments means you catch more. Having someone at home means the little yellow warning signs get noticed before they become red emergencies.
having someone who knows you, not just your chart, but you, makes every part of navigating health feel less overwhelming. Whether that support comes from a family member, a neighbor, or a professional caregiver, the research is clear. People who have a consistent, caring presence in their lives manage their health better, recover faster, and feel more confident. You deserve that kind of support, and you deserve to ask for it. Before you do anything else today, I'd love for you to do just one thing. Start your yellow folder. Grab a folder, any color. Write down your medications, the name, the dosage, and what it's for. Add your doctor's numbers. Put it somewhere easy to find. That's it. That one step could make your very next appointment better. In the description below, I've put together a free printable, your doctor's visit checklist, that has the STAR method, the Big 3 worksheet, and the discharge stoplight, all in one page. Print it, put it in your yellow folder, and you're ready. If someone you love could use this, a parent, a neighbor, a friend, please share this video with them. Sometimes the most loving thing we can do is put the right information in the right hands. Subscribe to the Elder Care Insider so we can keep these conversations going. Every week we're here with clear, honest, practical guidance for you and for the people you love. Your health is worth fighting for, and now you have the tools to fight for it.